Regional terms or surface anatomy terms are all over the body. Every bump or indent in the body has a different regional term. The benefit to knowing these is to help identify different areas of the body, which will then allow you to identify what's below them and put references to what you're talking about. So for this one, we're going to take this and kind of blow it up to make it a little easier to see. We'll start with the top left of this image, looking at the frons or the frontal region. You can think of that as your forehead. You move down, and just below that, and all around the entire head, is the cranium region. So it's not just the front being the cranium, but on the sides and the back as well. Faces, or the facial region. That's the entire face. So that's going right from the forehead right down to the chin. So that entire region is going to be the faces, or the facial region. Oris, that's your oral region. Oris or oral. Think mouth, because oral refers to mouth. So oris or oral, those are your mouth. You then have mentis. Mentis or mental is the chin. So the mentis region, the mental region, looking at the chin. The axilla or axillary region, that's going to be the armpit. The axilla or axillary region. For example, that'll come up later in AMP2 with blood vessels, because the axillary artery and axillary vein are found in the axillary region. You then have the brachium. Well, brachium is going to be the upper arm. So brachium or brachial is the upper arm. Antecubitus, that's the front of the elbow, or the anterior part of the elbow. The antecubitus or antecubital. You then have the antebrachium. That's your forearm. The antebrachium is the forearm. The carpus or carpal is going to be your wrist region. Well, those 8 bones that are in your wrist, those are the carpal bones, hence why this is called the carpal region. You may have heard something similar like carpal tunnel syndrome that affects the wrist, which makes sense, the carpal region. You then have pollex. That's your thumb. Pollex is the thumb. The palmar or palma region, that is the palm of the hand. The palmar or palma region. Digits or digital region, those are your phalanges. Think your fingers. So the digits or digital region. You then have the patella. Patella or patellar region is going to be your kneecap. So patella or patellar. The crus or the crural region is the anterior part of your lower leg. Think your shin. That's the crus or the crural region. The fibular region is going to be the lateral side of the lower leg. So while the crus is going to be the anterior parts of the lower leg, the fibular region is the lateral side of the lower leg. The tarsus or tarsal region is going to be the ankle itself. So tarsus or tarsal. Digits, just like back up in the fingers, digits or digital is also toes. So yes, that's the same exact term. So the fingers and the toes are both the digits or digital regions. If we switch to the right side of this image, you'll see that there's the oculus or ocular region. Oculus, ocular, those are eyes. You're seeing vision. So oculus or ocular. Bucca or buccal, that's going to be your cheek. So buccus or buccal. You have oris or otic, that's ear. Otic, ear. Nasus or nasal, think nose, nasal. So the nasus or nasal region. The cervices or the cervical region, that's going to be the neck. Why? Well, that's because you have the cervical vertebrae that make up the neck and give structure to it. So the cervices or cervical region. Now the next is actually a grouping called the trunk. The trunk is everything from the top of your shoulders right down to your waistline. but it's made up of several different regions within that trunk or torso region. You have the thorax. Thorax is going to be the upper portion. Think diaphragm up. So where lungs and heart is the upper chest. So the thorax or the thoracic region. You have the mamma or mammary region. Now, mamma or mammary region sometimes also can be referred to as the pectoral region because they're found where that pectoralis muscle is, but the mamma or mammary region. Abdominal or abdomen region. Think where your stomach is, your intestines. That's the lower portion of the torso or trunk. So the abdomen or abdominal. The umbilicus or the umbilical region. Think belly button. Umbilicus, umbilical. And then you get down to the coxal region. Now here it's saying it's the hip region, but usually it's referred to more as the coxal region. That's going to be on the side because that's the coxal bone that is having a portion protruding. So the coccyx or the coxal region. You then have pelvis or the pelvic region. Pelvis or pelvic. That's found just below where the umbilical region is or the belly button. As you head down a little more inferior to the pelvis, you end up with the inguinal or the groin. The inguine or inguinal regions is basically right just above where the groin is. But the actual genitalia itself is referred to as the pubis region. So you're looking at from the pelvic just below the umbilical region or belly button. Then you go more inferior to the pelvic region, you go down to the inguinal region, and below the inguinal region is going to be the pubis region. From there, you can see the upper leg is the femur or femoral region, because that's the bone there, the femur. And then the foot itself is known as the pedal or the pes region. Pedal is foot. Now if we switch from the anterior view, which were all these, to the posterior view, you're going to notice that on the posterior view, you're going to see some of the same terminology. So we start on the left side again of this diagram. The acromial region is the shoulder, so acromial region. The dorsum is the back. So if you go to the middle of your back, that's the dorsal or dorsum region. The brachial region, we already did, upper arm. But here's a new one, olecramal or olecranon region. That's your elbow. So olecramal or olecranon region is the elbow. Moving the next one down, you see the lumbus region. That's the lower back. So right in the lower back, right where the lumbar vertebrae are located, is the lumbus or lumbar region. You then have the sacral region or the sacrum. That's the very bottom of your vertebrae, right between your hips. So the sacral region or the sacrum is right down at the very base of the vertebrae. We already covered the antebrachial region, the forearm. Hand is referred to as manus. So while pedal was foot, hand is manus. The gluteal region or the gluteus region, that's going to be basically your buttocks. So the gluteus or the gluteal region. We already mentioned the femoral region, upper leg. The back of the knee is known as the popliteal region or popliteus. So back of the knee, popliteal region. We went through the front or anterior of the lower leg, the shin. That was the curl. But now on this posterior side, the posterior is sura or sural. So in the back of your lower leg, so think behind the shin, that is going to be the sura or sural region. The heel is the calcaneal region or calcaneus, named after the bone that is your heel, the calcaneal bone. So the calcaneal or calcaneus region. And then the bottom of the foot, remember foot was pedal, so bottom of the foot is going to be the plantar region or the plantar region. Plantar or plantar region. All right, shifting over to the right side of this image, we have the cephalic or the cephalon region. That is the entire back of the head. So the entire back of the head is the cephalic or cephalon region. We mentioned the cervical was the neck. The last two are just the limbs, the upper limb and the lower limb. Upper limb is going to be the arm. Lower limb is going to be the leg. So switching back from full screen now, why are these important? Why do I even care about these? As you get into this skeletal and the musculature, the nervous, the cardiovascular, as well as pretty much every other system, a lot of these landmarks will help you to identify structures below. As I mentioned, the acromial region, this bump. We get to the skeletal system, that's the acromion process. The upper arm was the brachial region. Well, you've got the biceps brachii, the brachialis muscle, the brachioradialis muscle, the triceps brachii, the brachial artery, the brachial vein, the brachial nerve. You get the point. A lot of these surface terms will help you to identify where the other organs and systems and parts are that we're looking for. So it can help going forward knowing these surface anatomy or these regional surface anatomy terms. Again, building up, we're building a foundation moving into the future of the course and the human body.